Hi, can everyone hear me?
Yeah!
Okay, well I'm here, first of all, to remind what you all know, which is that job one today is kill the bill!
Kill the bill!
And job two is to preserve the ACA. But the real shining city on the hill at the end of all of this is single payer. And I want to say a few things about that because the Republicans lie and lie and lie about health care.
That's right.
And one of their biggest lies is that you shouldn't buy health insurance if you don't need it. Now let's think about that for a minute. Some of us have a car. If you have a car, you need car insurance. But if you don't have a car, you don't need car insurance. I'd agree with that. That's your third biggest asset. Your second biggest asset is your home. You've either got stuff in your rental apartment or you've got a house. And you need renter's insurance, so you need home insurance. In fact, you're required to have home insurance if you have a mortgage. So that's a mandate. You're required to have health insurance if you're a homeowner, so that's a mandate. And if you rent your stuff and you don't have insurance, then you're taking a risk and you're going to lose it. So if you have a home, then you need home insurance. But your most valuable asset is your body. Anyone here doesn't have a body? Okay, so we all need health insurance. And remember that you have a body, because I'm going to come back to that twice. Now let's think a bit about why health insurance is so difficult. Because if you have a car, it costs $10,000, and if it's destroyed, then the insurance company pays out $10,000. So you can price the premium, and it works. We all complain it costs too much, but it works. If you have a home, it costs $100,000. You can price the premium of it being hit by lightning or something, and you can buy home insurance, and it works. But as an individual, you can't buy health insurance. Now, why is that? And the reason for it is that we all have a body. We could all get sick tomorrow, but you have no idea how much that illness is going to cost. It could be a $30 sore throat, or it could be a $250,000 case of leukemia that you get. And because the insurance company doesn't know how much you're going to cost next year, they're very reluctant to insure you, and they price premiums so they're unaffordable, and they force people out of the health insurance market. And this is nothing to do with being a Republican or a Democrat. This is simply the way that human health works and the way that insurance works. So there is no solution to insuring individual Americans with the kind of for-profit, multi-payer market that we have today. It hasn't worked for 70 years since World War II, and it won't work tomorrow, and it won't work next year or the year after. We need to get out from under this thing. So, part of the problem with insurance, health insurance, is that insurers don't want to insure sick people. How do you know if someone's going to be sick next year? Well, the best predictor of being sick next year is that you were sick this year. And that's why they run away from preconditions, and that's why they force people with preconditions out of the market. It's called adverse selection. People are forced out of the market. We do adverse selection as citizens, because if we're healthy, we choose not to buy health insurance if we can get away with it and take the risk. So the premium price goes up, people aren't insured, and you get what's called an insurance death spiral of the market, and it is a death spiral because people without a health insurance die. So we want to get out from under this. Now I've got another question for you. Is there anybody here in the audience that still has an appendix?
Yeah.
Okay, alright. Now I know that any one of you tomorrow might get appendicitis. But this gentleman here at the front who's nodding, I don't know if he's going to get appendicitis tomorrow, but you show me 1,000 people, and I know that one of them will get appendicitis, and I can price the premium for appendicitis coverage for 1,000 people, because I know one of them is going to get it, but I can't price it for one person. So the solution to the health insurance problem for individuals is to put them in a group. Now, what is the largest group of insured people in the United States today? Medicare. It has 65 million people in Medicare, It's worked since 1965 and people love it. Now why do they love it? One, because it covers every illness that you might have. Because everybody's covered, there's no pre-existing existing condition exclusion because there's nowhere to exclude people to. We're all in it. Two, you can see any doctor in the country. Three, you can go to almost any hospital in the country. Four, the administrative cost of Medicare is 2% of the total cost. With private insurance, it's around 20%. So you move to single payer, you get $18 to spend on healthcare rather than on administration. Like that? So it's going to be cheaper. But the real advantage of Medicare is that it covers everybody. You pay into it, and you're covered. That means that people who are disabled are covered, people who are unemployed are covered, people who work part-time are covered, people who have seasonal work are covered, individuals who are working are covered, people who are working but don't get healthcare benefits are covered, people in small companies are covered, large companies are covered, everybody's covered. Small business likes this because it takes away the hassle that they have with getting health insurance for their employees. And large business likes it because it removes the cost of healthcare from their expenses and makes them more competitive internationally. So these things are all good. Now why don't we do this? Well, this is considered in a Republican lie like socialized medicine and stuff like that. But I'm going to bring you back to the body. And here is the thing about the body, that in the United States we protect our bodies from the threat of attack by things outside the country. The way we do that is called the Department of Defense. And the way we fund the Department of Defense is through tax dollars, where everybody pays in according to how much money they make, and everybody takes out whatever they need for the defense if the country is attacked. We don't say, you haven't paid in much, so you get 2 hand grenades. But you, Mr. Millionaire over here, you paid in a lot, so you get a nuclear missile. We don't say that for protecting our bodies through national defense. So why don't we do the same thing to protect our bodies from internal attacks by disease and sickness?
That's right.
So what that means is that Medicare, which is paid for through taxation on your income, you don't make anything, you don't pay anything into it. If you make a little, you pay a little in. If you make a lot, you pay a lot into it. And then you take out of it what you need when you get sick. This is called social insurance, and we need to move from health insurance to social insurance, and we need Medicare for all. So, today, the message is, kill the bill. But tomorrow, the message will be, Medicare for all. Medicare for all. Thank you.